Everybody, welcome to Pick Dr. Osborne's Brain. We got a great live Q&A for you today. If you're new to the show, you know the drill. If you're old to the show, but if you're new to the show and you've got questions on health, nutrition, go ahead and start typing those in now. I'm going to do my best to get them answered as we go through today. And don't forget as well to pay a visit to our sponsor, makes this show possible, Gluten Free Society. You can visit glutenfreesociety.org. And don't forget to take advantage of this week's special, Ultra Collagen, which is our gluten-free supreme collagen formula for healthy skin, bones, muscle, and joints. And if you use promo code SKIN this week, you can actually save $10 off that bottle. So don't forget to take advantage of that if you're in the market for some collagen. So let's dive in to our Q&A. So the first question coming in, excuse me, Chip's asking, could you recommend a good post-workout protein powder for smoothies? Yes, Chip, this is my favorite. It's called Ultra Pure Protein. We have 3 different varieties. We've got one that's chocolate, one that's vanilla, and one that it's no flavor at all for those of you who are super ultra sensitive. That's the version to go with, and you can flavor it mixing it with your own fruits or other agents. But those are super high dense nitrogen proteins that are going to be bang for your buck, probably the best on the market in terms of post-workout recovery. We'll put a link up for you if you want to go look at those and read more about them. But those are grass-fed bone broth proteins with, again, a very, very high nitrogen value. So has a higher let's say higher protein rating than the most highest food-based protein rating of eggs. So it's has a higher rating than eggs. So fantastic protein. Can you take vitamin K2 with a factor 5 laden? I'm assuming you mean, Linda, you have the genetic factor 5 laden increased risk for blood clots. The answer is you have to take vitamin K2, not necessarily supplementally, but vitamin K is an essential nutrient. You can't survive without it. Your body needs it to properly function. Now, vitamin K2's primary job is to help mineralize your bone, whereas vitamin K1 is necessary for the clotting cascade. And so if you're trying to link up, should I take vitamin K, excessive vitamin K, or high doses of vitamin K, it would be more of the K1 that you would want to avoid taking if you were concerned about that risk. That being said, lots of folks with factor 5 genetic issues can still take vitamin K supplementally. I would just recommend that you work with your doctor to make sure that if you're going to use vitamin K1, that you have a deficiency and that you can justify its use, if that makes sense. So, but it's not necessarily dangerous because you have factor 5 to take vitamin K2. Let's see here. Aisha's asking, she says, it's frightening how mold is causing skin problems and more. Is it enough to wipe away mold, control the humidity, and use oils to help heal the skin? Is vinegar strong enough to kill mold? No. Don't use vinegar in your attempts to try to kill mold. Vinegar's not going to do it. Most of what is in vinegar is water. And that's what mold needs to grow better. So it's the same thing with Clorox. A lot of people try to use bleach to kill mold, and bleach is like 98% water. So you're just making the mold not visible as you bleach out the mold, but you're not necessarily killing it. Bleach is not what we would use. Vinegar is not what we would use. The best way to kill mold on the skin, in my opinion, in my experience, is one of the best things to do is to shore up your own immune system, because the reason mold can grow on the skin typically is because the immune system of the host is compromised. So if your immune function is poor, then mold has a greater opportunity to grow on you, because mold is everywhere. We have a microbiome or a mycobiome, myco indicating mold, right, or fungus. And so it's not that we have zero mold on us or in us, it's that it should never be allowed to propagate beyond or out of control. And so what happens when people have an immune system that's not working up to par is that mold acts as an opportunist and can start growing on the skin. So build your immune strength and do that through diet and lifestyle, right? What are the fundamentals of diet and lifestyle? Only eat real food. Number one. Number two, get adequate sleep. Number three, get adequate sunshine. Number four, exercise regularly. Number five, clean air. Number six, clean water. Number seven, mitigate and manage your stress well. If you do those things, you're going to be encouraging your immune system's strength and power, so that you shouldn't be susceptible to mold growing on your skin. Now, that being said, what can you do beyond, to stop mold from growing in a home? That's a totally different conversation than mold on the skin, although sometimes there's some interrelationships between the two. But one of the best ways, if you've got like a mold type growth on the skin, and many people do, there are a number of different types of skin-based mold infections. One of the best things you can do is sunshine. Mold doesn't like sunshine, direct sunshine, so getting ample and adequate sunshine over the area where you have the mold growing can be an effective strategy. Also, using hydrogen peroxide is one of my favorite. Application of douse a towel or a cloth in hydrogen peroxide and apply that as a compress for 10 to 15 minutes over the area can be a very, very effective strategy if there is a mold growing on the skin. And then other things that can be used, some people use hydrolyzed silver in that situation to support the skin's immune health. And then beyond that, it goes back to those choices that you can make day in and day out, and whether or not you're doing something that's compromising your immune system and allowing for that mold to grow on the skin in the first place. Let's see, what collagen supplements or powder would you recommend? So I think I answered that actually already with our sponsor today, Ultra Collagen. And again, I think we've got that link up in the feed for that question. When using oil, let's see here. What causes hollow, sunken in, dark circles under the skin of the eyes? Having the opposite issue of puffiness, I'm guessing lack of sleep, possible food sensitivities, dehydration. Those are all good guesses. The dark circles under the eyes are almost always allergies of some sort, whether those allergies are to environmental chemicals or environmental dander, pollen, dust, things of that nature, or to foods directly. So that is very, very common. Now, some people will get a sunken in aspect under the eyes, and there are a lot of different reasons why that can happen, but one of the big reasons that I see is a lack of protein in the diet, and so they're actually losing weight, and so that weight loss can occur. For a lot of people, it really hits the face hard, and so there's a weight loss that can create that sunken in nature behind the eyes. The other thing that causes that is chronic stress. Chronic stress will definitely create that type of appearance around the eyes. So your hypotheses or guesses on lack of sleep, food sensitivities, dehydration, all accurate, all good speculations as to why that can happen. Could low insulin cause the same presentation in the eyes? I've never tracked that back to low insulin per se. It would not be at the top list of my suspicion. Yeah, any update on the blood test that we'll be doing? Which blood test, Mohammed? If you're talking about nutritional deficiencies, we're looking at launching that in the first quarter of 2023. So that's currently our goal, and that's the best update I have for you on that. Do you have something that does not have coconut? I can't do coconut. I don't really know what you mean. Can I recommend something that doesn't have coconut? Anything that doesn't have coconut. In regards to what, Tina? What specifically are you looking for recommendations of? Is there a ratio of sunlight exposure and vitamin D absorption, such as per region and recommendation, how much to take? I'm in the Pacific Northwest, could figure out how much D to supplement in the winter. The best way is not trying to calculate based on a ratio of your latitude and the time of the year. Teresa, the best way is to measure your 25-OHD levels first and foremost. Ask your doctor to look and measure that for you. There's generally a reference range depending on the lab that's doing the testing. For most labs, the reference range is somewhere between 20 and 100. And what you're aiming for in those winter months is really ideally no less than 50 if you're trying to support your immune system going through the winter. And so you can adjust your vitamin D supplementation based on what those levels are. Now, some people way undershoot it. So like, let's say, for example, your levels came back at 30 and you were trying to get it to 50. A lot of doctors are going to tell you to take 4,000, 5,000 units a day, and that won't touch it. 4,000, 5,000 units a day won't really give you much of a bump in your serum 25-OHD levels if you're doing that supplementally. You'll probably, if you retest it, you probably might get from 30 to 35, maybe even as much as 40. But if you're trying to get over into that 50 range, between 8 and 10,000 units, and that's generally a very safe amount to take, even over a long period of time, without worry of any kind of toxicity or other issues. Just a few caveats there. If you've got major chronic kidney disease or autoimmune disease affecting your kidney, you should work with your doctor to figure that piece out. But if your kidneys are fine and healthy, you don't need to worry about 8 to 10,000 units of vitamin D daily. But do that for a month and retest it. See how well that increased it or it didn't, and then you can adjust that dose up or down accordingly to what your lab is looking like. That's the best way to really monitor your D in the winter, not to try to use a generic calculation that some of these apps offer. Generic calculations based on the time of the year and where you're at and where you're located geographically. So Tina's coming back with more clarity. She's asking about, can you recommend a bread product without coconut? There are a lot of actually flours that you can use that are not coconut based, Tina, to make breads if your bread doesn't work for you. We're going to put up a link in the feed for you. We have an article on grain-free flours, and so I'd encourage you to explore those as other options. Now, coconut flour is on that list, but so too are many other flours that you might find helpful. For example, arrowroot, tapioca, cassava, tiger nut. Those are all really good flours that you can use and that bread can be made from as well. So, question about the nutrition testing. When you have it available, will that also be the lymphocyte proliferation test? Yes, it will be. You guys always hear me talk about the right way to test for nutrition and the wrong way to test for nutrition when you're measuring. And the worst way to test for vitamin and mineral levels, in my opinion, is using serum blood tests, because they're not accurate. They give you false negatives and sometimes even false positives of normalcy. And so lymphocyte proliferation, you hear me say that word over and over and over again as the right tool to use to measure nutritional status when you're trying to make decisions about what vitamins and minerals your body needs more of. So it's the only kind of testing that I would ever introduce to the public would be that. So yes, when we introduce that, it will definitely be lymphocyte proliferation. Skin eruptions from shingles. Anna wants to know, what's the best method for dealing with skin eruptions from shingles? One of my favorite things to do, shingles, when they come on, if you have shingles, and again, most people, when they get shingles, it's kind of a one-time event for a number of years, because when you get shingles, your body mounts an immune response, and then you're really pretty well protected from that for a long time. But so if you're not familiar with the initial onset of symptoms of shingles, what happens, how you might suspect that shingles are about to happen to you, is you get somewhere along the region of the spine. This is where shingles usually occur. Not always, but very typically along the region of the spine, sometimes in the front and the abdomen. But you'll start to get a deep, itching, almost burning sensation that will begin before you see any shingles actually raise or elevate off of the skin. And so at the first sign of that type of symptom, one of the things I like to have people do is take something called Virid, V-I-R-I-D. We can put a link up to that for you. It's a mixture of different nutrients that basically help support your immune system's ability to shut down viral replication, okay, which is what shingles are, is a form of virus, varicella. And so using this at the first sign of shingles developing is one of the best ways to support your body during that time. Because once the skin lesions start erupting, it's going to run its course and it's going to be pretty painful. Now, you can still use Virid during that time if you don't catch it early, and it can still be very supportive. But that would be kind of the one thing that I would say for sure to do nutritionally to support your body. Let's see here. Does Detox see? No. What spices could I put in the breakfast sausage recipe of no grain, no pain? I'm not a fan of sage and fennel. Any spices. Taste is relative, Linda. I always say, and what I like may not be what you like, but I don't think you can go wrong with a spice if by adding it, it imparts a flavor that you enjoy in the meal. So you know you better than I know you in that regard, and I wouldn't sweat, ruining the recipe per se. I'd just say experiment with it and use what you like. Do I have any recommendations for brands for L-glycine and creatine, since they aren't part of your supplement line? So L-glycine, we actually, depending on what you're trying to get, if you're trying to get L-glycine, what I would say in our supplement line is we have a product called Ultra Aminos, and it's all of the essential amino acids in a powdered formula you can mix in with a smoothie. Beyond that, if you're talking about creatine, find a good, reputable, trusted brand where the creatine is just pure creatine monohydrate and there aren't any of the other fillers. Where people go wrong with creatine, in my opinion, is the premixes, the powders that have all the extra corn syrup and flavoring agents and all the other things that could pose as hidden sources of gluten. But if you just get a pure crystalline creatine monohydrate powder, from a good reputable brand, that's what I would suggest you do. I think creatine is one on our line of interest. We may be coming out with that soon because of the amount of people that are asking about it. What causes rosacea? If you mean rosacea, Elaine? Lots of different things can be triggers for rosacea. There are different bacteria growing on the skin, fungus growing on the skin. Gluten can be a trigger for rosacea. I've seen other food allergies and sensitivities be triggers for rosacea. I've seen women's cosmetic formulations that women use on the face commonly be triggers for rosacea. Hot beverages are sometimes triggers for rosacea. So it can be a tricky thing to determine. And because it's unique to the individual, but those are just ideas that you can start with. Because if something's triggering it, that answers the next part of your question, which is what can be done about it. And that's depending on what's triggering it, right? So you got to figure out what the triggers are first. Now, what some people will do and find can be very helpful while they're trying to figure out the triggers is there are a number of different homeopathic remedies that can be used. They're not, in my opinion, solutions to rosacea, but they can be used. Some people also use different types of skin products that contain ASA, acetylsalicylic acid, which is an anti-inflammatory that can be applied directly to the skin, although that's not something I would encourage anyone to do long term, because ultimately you don't want to mask the rosacea, you want to know why it exists in the first place. Kate says, I tried your Detox C, and though I liked it, it didn't like me. Ascorbic acid irritates my oral lichen planus. What source of vitamin C you recommend for replacement? Really, any good reputable brand, Kate, that is not a corn-derived product, because that's what you really have to be careful of with vitamin C, is that, you know, a huge majority of products that are over the counter are actually, you know, GMO corn-based vitamin C products. So you don't want to get the GMO, you don't want to get the glyphosate, and if you're gluten sensitive, you don't want to get exposure to the corn base in those. So some people use like a vitamin C derived from aerosol cherries. Some people use moringa vitamin C powders. So there are a number of different options, food-based option vitamin C powders that you could attempt to use in lieu of Detox C. Shannon asks, is our collagen tested for heavy metals? The answer is yes. Scroll down on that left. Oh, go back. Sorry, missed that one. A little more. Oh, I missed it. Another one about mold on the skin. Any secrets if mold is growing on the skin? You know, the best thing that you can do with mold growing on the skin, as I mentioned earlier, is boosting the immune system through your choices and behaviors. But sunshine, hydrogen peroxide, or silver are three things that are not toxic that you can do that might really help. Best options beyond RO water. So if you're talking about water filtration, RO is reverse osmosis. If you live in a city, the city water supplies are largely, in my opinion, not trustworthy. You know, there's fluoride. If you live in the U.S., there's fluoride in them. If you don't live in the U.S., if you're in the U.K. or Europe, not so much the fluoride, but you still have to worry about chlorine, bromide, chloramines, other potential chemicals that people flush down their toilets. You know, there's a recent study done. This was published by the AP a few years ago. In Houston, as an example, there were 42 prescription medications found in the drinking water from people's taps. I don't want to drink 42 prescription medications in my drinking water. This is why, if you live in a city, I recommend reverse osmosis. Hands down, best kind of filter if you're in the city. Now, if you're on a well, you may not need reverse osmosis. And so for a well, something like a strong carbon, granular activated carbon, and KDF filter would suffice, you know, just fine. And one of the other things, though, you want to consider, as we talked about on Tuesday, is a water softening system depending on the hardness scale of your water, because hard water can really wreak havoc on the skin and create pronicity towards skin inflammation as it strips away the oils on the skin. So carbon, KDF, and possibly water softening, you know, if you aren't in the city, as options, if you're on a wells type system. What natural ingredients from the kitchen can I use as electrolytes in RO water? Natural ingredients from the kitchen, salt. Particularly either like a sea salt or a Himalayan salt. If you just want to throw salt in there, that gives you some good electrolytes in that water. We actually have a product called Ultra Electrolytes, which is a Ultra Trace liquid mineral formula with electrolytes in it that you can add to your RO water. And you know, the recommendation is about a half a teaspoon for every 20 ounces of water that you consume that's RO in nature. I've been gluten-free for 9 full months, so I'm still losing weight, but my stomach is swelling. I look pregnant. What tests do I need to do to figure out what might be going on? Pamela's asking. So Pamela, get with a good doc and have your microbiome assessed through the right kind of testing, because you could have some other microorganisms that are in your GI tract that are growing, that are producing byproduct of gas that's causing that distension. You could also consider food sensitivity testing beyond gluten. Some people are reactive to gluten, but are also reactive to other foods, and they're even going gluten-free. If you're eating more of those other foods in lieu of not eating gluten, but you're reactive to some of those other foods that you're eating, that could also be, a common trigger in that regard. So I would start with, at the very least, with those two things. Brenda's asking, what brand for RO, reverse osmosis, do you use? There's not really a brand, because the technology, the RO platform technology, it's the same. I mean, it doesn't matter who you call, you're pretty much going to get the same reverse osmosis membrane infiltration. The key with RO is not so much the brand as it is who you get to install the unit. So like if you're installing one under your sink, and making sure that that company is reputable and that they will service the unit for you and test it periodically for you to make sure that your filter doesn't fail. I've seen a number of cases where RO filters actually, as time goes on, they fail, right? And so they're no longer filtering what we think they're filtering, and so people are being exposed to all the things they think they're filtering out. So the best thing to do is hire a good, reputable local company if you're installing an RO unit under your sink to come out and make sure every 6 months that the unit's being serviced properly. And don't worry as much about the brand. Again, it's the reputation of the company. If you live in the greater Houston area, we do have a company that we recommend. They're called Pure Water, and they do a really good job. The owner of the company, Raj, I call him the water whisperer, because he geeks out on water. Like, he loves geeking out on water and understanding the aspects of filtration. So find a company like that in your area. If you're not in the Houston area, or if you're in Houston, check out Pure Water Supply if you're in the market for RO. And if you're in an apartment, you can't install an RO unit, we have recommendations for countertop RO units that you can buy, that you can take with you if you happen to move. Let's see. Can you drink water softener water? Yes. Yeah, you can drink it. And a lot of people think that, water softeners can, if you're using salt to soften the water, that the water itself, if you drink it, will increase your blood pressure. And that's kind of a myth. Not true at all. Drinking softened water is perfectly fine. Do you suggest taking copper with collagen? You can. You need copper for what's called collagen cross-link formation. This is if your body is building collagen from amino acids. Remember, your body can synthesize collagen internally from amino acids, and to do that, it requires copper to strengthen and shore up the collagen molecules. But if you're taking collagen as a supplement, you're getting in the collagen protein and absorbing the collagen protein. So there's not copper as much necessary if you're taking a copper or a collagen supplement. But you can definitely take them together. I would just suggest, if you're not sure whether or not you should use copper, again, test, don't guess, because if you need it, copper can be very beneficial to the health of your skin and the integrity of all of the tissues in your body that require collagen as a basis, foundational basis. Would sodium bicarbonate help on acute mold on the skin? It's not what I would choose. Not at all what I would choose in and of itself, by itself. If I were going to pick one ingredient that I could apply to my skin for antifungal properties, hands down, I would choose hydrogen peroxide. Very safe, not dangerous to do. You can apply it multiple times a day without any side effects, and it can be extremely effective. How long does it take to see results of removing food allergens from the diet? I remove beef, collagen, olive oil, rosemary, and lemon. How long does it take to see a result? It depends on the nature of the problem, and it depends on 1,000 other variables that may be present in your life as well. But if you've paid attention, a few weeks ago, I had a guest on the show, Dr. McCullough, Sina McCullough, was a guest. And in her case, it was within a week that she was able to get up off her floor from severe arthritic pain after removing food allergens, food sensitivities from her diet. And I can just say that's a really rapid response. It's a really fast response. Now, it's not to say that you couldn't have that same type of a quick response, but most people, it's not quite that fast. We're going to see slow, steady changes, slow, steady improvements over a period of about a month to 2 months is what we're looking for. But some people much quicker. If your symptom is heavy ridged nails and you're talking about removing food allergies, and if you have a heavy ridged nail, that can mean a lot of different things. I mean, a heavy ridged nail could mean anemia, and so you could have an underlying anemia that's not being addressed that could be contributing to that as well. And that, removing a food allergy won't necessarily directly remove the ridge in the nails. Let's see, under that Facebook feed, let's go down, see what else we have there. Thoughts on collagen and L-glutamine on healing leaky gut? I think if you're going to heal leaky gut, you have to, before just assuming that collagen and glutamine are going to be helpful, you have to ask a deeper question, Jennifer, which is, why do you have leaky gut? Now, if the reason you have leaky gut is because you have an L-glutamine deficiency, then yes, absolutely, hands down, L-glutamine. But if the reason you have leaky gut is because you have a yeast overgrowth in your gut, L-glutamine is not going to really do much for that. If you have leaky gut because you're eating gluten, L-glutamine is not going to fix the fact that you're eating gluten. So if we really have to go back and those of you who have a copy of No Grain, No Pain, I think we have the same diagram at Gluten Free Society. It's what causes leaky gut. We have a really robust, comprehensive article on that topic. And because there are a dozen or so different common things that cause leaky gut, and so it's more important, instead of just trying to supplement with glutamine and collagen to fix what you think might be a leaky gut, it's important to know why you have it first. Because once you know why, you can address the behavioral change that needs to come with that, right? So if you're gluten sensitive and you didn't know it, gluten can cause leaky gut. A bacterial infection can cause leaky gut. Exposure to different chemicals can cause leaky gut. Pesticides can cause leaky gut. Certain medications can cause leaky gut. So what is it that you have going on that's contributing to the leaky gut first and foremost? Once you know what that is and you remove the triggers, you can use supplements like collagen, L-glutamine, deglycerinized licorice, aloe. These are all just things that help support the healing of the gut, but they won't resolve a leaky gut if you don't resolve the triggers first. Triggers have to come first. What's the best omega-3 oil? I've heard cod liver or krill. I don't think either one of those are the best. If we're talking about the best omega-3 oil to balance out relatively well the quantity of EPA and DHA, which are the two main types of omega-3, cod liver oil is not a good choice, and really neither is krill, in my opinion. We actually use a blend of different types of cold water fish because what we try to achieve and we have a couple different products. One's called Omega Max. The other's called Ultra Omega. And what we're trying to do with those is give a better unified or uniform blend of a combination of EPA and DHA so that you get both. Because cod liver oil's high DHA but not high EPA, so you don't get much of that. And krill oil's much the same. You don't get much EPA. You don't get great EPA from krill oil unless you're just taking massive quantities of pills. So my advice would be, if you're looking supplementally, I would look at Omega Max or Ultra Omega. What's the difference between the two? Predominantly, Ultra Omega was designed for people without gallbladders or with fat malabsorption problems. We actually put some enzyme in that omega-3 that helps to digest the fat aspect of the omega-3. And so people without gallbladder struggle to do that, and people with fat malabsorption problems struggle to do that. So Omega Max, if you have a great gallbladder and you don't have a problem with fat malabsorption, Omega Max. If you have no gallbladder, a problem with fat malabsorption, Ultra Omega would be the best option for you. Let's see here. A lot of questions about mold, about Candida. What can be done about Candida growing in the skin and in the hair? I think, again, going back to what I've already said, the fundamental thing that has to be addressed is, why do you have an immune system that doesn't have the strength to handle, naturally keeping Candida at bay? We all have Candida, but whether or not we have Candida overgrowing is another matter. And the answer to that lies in your immune strength and your immune system. Let's see here. Go down on that center. Keep going. Let's see. Melanie says, I'm gluten sensitive. That bottom, yeah, there we go. I'm gluten sensitive and develop rash and hives if I get it. Oh, well, there's not a question in that. So if you're developing it's a common thing to develop rashes or hives if you're exposed to gluten and you're gluten sensitive. It's actually a quite common symptom to experience for many people. Let's see. I don't know if I'm pronouncing this name right. Zalata asks, I have celiac disease and my pancreatic elastase is low. What should I do? I took a high dose of Zinpep and had stomach issues. Should I start on a lower dose? When I see people that have low pancreatic elastase, Zalata, I use a product called Ultra Digest. And it's a full spectrum digestive enzyme that's designed to help support digestion when the pancreas is underperforming. Ultimately, your pancreas should recover if you get the gluten out of your diet. And if you're celiac and you are on the traditional gluten-free diet, the wheat, barley, rye-free version, it may not be enough because many continue to struggle with that traditional gluten-free diet. And so you want to maybe look more closely at the true gluten-free diet. If you don't know what that is, you can learn that a couple different ways. Number one, you can read my book, No Grain, No Pain, which I recommend every celiac in the world read as kind of base knowledge of how to understand and navigate the gluten-free diet. And number two, you can take my Glutenology Masterclass, which is free. And that you can register for that absolutely free at glutenology.net/registration. Is it true that skin can turn blue if you consume excessive silver? Is silver okay to consume in small concentrations every day for general health? So if you take silver in a hydrolyzed form, it will not turn you blue, and you'll excrete any excess. And it's very safe to take. There's no long-term ramifications of health risk by using a hydrolyzed silver in that fashion. Now, colloidal silver is another matter, but hydrolyzed silver won't turn you blue. If you're looking for silver that's hydrolyzed, we have something called ultra silver, which is a hydrolyzed silver and not a colloidal. What would be your morning and nighttime skincare routine for optimal anti-aging? So Nolan, that's a great question. My optimum skincare routine for anti-aging is a clean diet, honestly. I generally don't put things on my face. I generally don't even wash my face with soap every day because soap strips the oils, the natural oils, the health-giving and vitality-giving oils are on the skin. And if you soak those away, a lot of women do this. They soap their face down twice a day. They're stripping their face down twice a day with astringent soaps, naturally removing the oils that give great protection, and they're doing that in order to apply other creams and lotions that would moisturize the skin. I never understood that, but that's kind of the industry and the way it's promoted healthy skin care. But I believe that the true path to healthy looking, vibrant looking skin is a clean diet and a great set of behaviors around that diet. So going back to fundamentals, what are they? The right food, exercise, sunshine. A lot of women fear the sun. They've been told that, too much sun will damage the skin, and too much will, but no sun will also damage the skin. So we have to come to the happy medium of our skin tone. And then, beyond that, and getting enough sleep, right? Prioritizing sleep, prioritizing clean air and water, and prioritizing stress. You do those things consistently day in and day out, you're going to have healthy looking skin. All the creams and lotions and potions you want to put on the skin are not going to prevent you from aging. The true aging prevention, and I shouldn't even say aging prevention, none of us prevent aging. We're all going to age, all of us. The level or the speed at which we age is dependent upon those 7 choices that we make every day. The worse choices you make, the more you accelerate damage to your body, the more that accelerated damage utilizes up the resources that you would otherwise expend less of, right? So you basically, you ask your body to burn through more of its nutritional resources by making the wrong decisions, and that manifests or shows up as an aggressive aging as opposed to a graceful aging. This is why smokers look older, on average 10 to 20 years older than non-smokers. This is why people that have a high diet consistent with heavy amounts of junk food and processed food look older. If you look at, I'm 50 years old, and if you look at most of my male counterparts in the US that are the same age, they don't approach the youth in their face that I do. I look younger, but it's not that I'm doing anything special. I'm just taking care of my body, and they're not. And so they're aging more aggressively, and I'm aging more gracefully. So never forget that, because there's not a routine that is going to miraculously change the nature of how aggressively your body's going to age. The best routine is to take care of yourself every day. Would Ultra Collagen be good for an inguinal hernia? Could be. I mean, you need collagen to form the soft tissue and the connective tissue around that hernia. So it's, definitely be supportive. Let's see here. What do we got on that? There we go. On this side right here. Can there be I like this question. Can there be a gluten component to Bell's palsy? A good friend had the flu and developed Bell's palsy out of the blue. There seems to be different ideas of what causes it. And it's because it's not a singular factor. Bell's palsy, which is a form of neurological facial paralysis, can be triggered by gluten, and no doubt about it. I mean, I've seen that. I've actually seen that in my practice a number of times, where Bell's palsy flares, went away after a person changed their diet. But Bell's palsy can also be caused by viral infection, because certain viruses can affect the cranial nerves, which feed the face, and so that's a possibility. So your friend who had the flu, that could have been kind of part of why that was triggered. We also see autoimmune triggers for Bell's palsy, which basically means that any food could potentially trigger it, not just gluten. Any type of infection could potentially trigger it, not just viral. Any chemical exposures that might affect the cranial nerve function could also trigger it. And certain nutritional deficiencies I've seen be associated as well with Bell's palsy, predominantly being the B vitamin family. So like vitamin B1, vitamin B12, folate, B6, very, very important for neurological function. So if you struggle with Bell's palsy, those things are all things I would suggest you ask your doctor to help you look into. I like that. Marie says, I'm going to bring your book to a friend in Italy next summer. She has celiac. Can I bring you? Italy needs you to educate them. I'd love to go to Italy, just not in today's political climate. I'm not doing a lot of traveling right now. But yeah, Italy is it's a fantastic place to go. They've got a lot of great food there. So maybe we'll have to see. How much does it typically cost to inspect and treat a second-story house for mold? I heard it's quite costly. Well, that's a huge variable question. It depends. So good inspection, just a solid inspection, is going to cost you anywhere from $1,200 to $2,000. Anything less than that, you're probably not getting a good inspection. And, you know, mold inspectors, I've mentioned this before, you got to be real cautious with who you choose to hire because it's a weekend certification. And you can hire a mold inspector who really doesn't know or understand mold very well. They just come out and run an air test. And that's not a mold inspection. So don't spend $1,000+ on an air test. So just make sure that if you're trying to find somebody that they can do air testing, but that they also can do swab testing, that they also will do a nice visual inspection. They can do behind the wall testing. They have infrared cameras. They have other tools like fiber optic cameras they can shove behind your wall. They can measure airflow in your house. They have knowledge of looking at HVAC units to determine whether there's mold growing in your HVAC. Like there's just so much to a mold inspection. And you don't want to have somebody come out and, just to be frank, half-ass it and then give you a false sense of security about what actually is wrong, because that sets the stage. A good inspection sets the stage for the part two, which is remediation. And if the inspector doesn't find it all, and then they give you a remediation plan, and then you spend, I've seen remediation plans cost as much as $3,000 to over $100,000, depending on the nature of the problem and the extensiveness of the problem. And you don't want to spend all that kind of money doing mold remediation on a home based on a mold inspection that was inadequate. And this is where a lot of people get into trouble, is they don't line up the proper investigative process first. Like the first part of mold is find out where it's growing, and find out even more importantly than where it's growing is why is it growing, because that is how you remediate properly. If you don't know why it started to grow, you can't just wipe the mold away and it's magically gone now. It grew for a reason, and whatever that reason is, that mold inspector's job is to figure out why it grew. And if they're telling you where it grew, or they're saying there's evidence of it here, that's great. But if they're not telling you why it grew, that's not great. That's the answer that you need to have before you spend the money on remediation. Otherwise, you end up just throwing thousands of dollars away, and then you end up still being in mold. And nobody wants to spend money and stay sick, especially when the money and the dollars can get really high as it relates to remediation. Linda's asking, my daughter has celiac. She sometimes gets itchy, raised bumps, usually around the joints like her knees, knuckles, thighs, and bottom of the feet, very sore and inflamed. What might cause this? Well, if she's got celiac, what might cause that, there's not a lot of things, Linda. One is gluten. Obviously, if she's celiac, hopefully she's not eating gluten. I'll repeat what I said earlier, which is if you don't know the difference between a true gluten-free diet and a traditional gluten-free diet, then her problems might be persisting as a result of her not actually being gluten-free. So read No Grain, No Pain and watch the master class. The other things that sometimes contribute to that type of symptom, that's very common, especially in new celiacs, is malnutrition. So vitamin and mineral deficiencies that are necessary for the health of the skin. And, it's very common, for example, to see fat deficiencies, omega deficiencies in newly diagnosed celiac patients because they're fat malabsorbing. Before that diagnosis, they've had years of malabsorption leading to deficits of nutrients necessary for skin health. And so asking the doctor to measure her nutritional status through lymphocyte proliferation would be an important step in the right direction of understanding if there's a nutritional reason why those bumps are forming. What's my take? Wow, it's a different question. Mario wants to know, what's my take on vitrification of eggs and the hormone protocol a woman has to undergo prior to the eggs extraction? Is it dangerous for the body? Are there health risks? Yeah, and to me, the biggest health risk is not on the woman. The biggest health risk is going to be on the baby. This goes back to, this is I want to say this properly without offending, not that I'm worried about offending anyone, but without making somebody misinterpret what I'm about to say, which is if you're infertile, male, female, doesn't matter. If you're a man, you don't produce enough semen, or your semen break too easy, or their motility is poor, or if you're a woman and your eggs aren't very viable and you're having a hard time getting pregnant. In my opinion, the worst possible thing that you could do is go in for in vitro fertilization or to go in for fertility medicines. Why? Because they don't solve why your body is refusing to become pregnant. They don't solve for that. Why? The question you always have to answer is, why is a person infertile if they're infertile? Now, it's one thing if a person's infertile because there was some type of trauma to the ovary and they just, there's that physical damage that occurred or whatnot. But it's a very different matter when there's an unexplainable infertility issue and that the fertility doctors are now going to hormone their way around forcing a pregnancy on a body that is not capable of its own volition of getting pregnant. That's dangerous because now you're growing a baby inside of you where you didn't have the capacity to fertilize and to have viable eggs, and now you're going to ask your body to incubate a forced fertilization and to bring great health to that new child coming into the world. Some of the biggest reasons we see birth defects and major problems in kids has to do with the fertility industry. It's just my opinion. What should you do if you're not capable of pregnancy? The first thing you should ask yourself is, what is my diet like? Because the vast majority, in my experience, of unexplainable fertility is diet-based. And people are eating food that destroys their capacity at generating their own hormones. A perfect example of this is gluten sensitivity. We know from celiac research that unexplainable infertility is actually a very, very common phenomenon in those that have gluten sensitivity and don't know it and continue to eat gluten. And I've seen just in my career, and I'm not an infertility doctor, I don't treat infertility, but I've seen over the years a number of women have come into my practice for me to help them with their nutrition, and the byproduct of straightening out their nutrition was that they were capable of having a baby. They were capable. I've seen no less than 50 babies be born as a result of a woman who had a pre-existing infertility problem that no doctors could explain to her, and lo and behold, she changes her diet and her nutrition, and now she's having babies. So, set yourself up for success and set your children up for success. If you're infertile and you don't know why, start first with nutrition. Testing for food sensitivities, gluten sensitivity, testing for nutritional deficiencies, and then that foundation will give you better odds at setting yourself up for success of even just having a viable pregnancy, and 2, carrying that pregnancy through to term, 3, delivering a child into the world that doesn't have a host of different problems because you were not nutritionally sound enough for that fetus to to mature and grow at the stages along the way that were necessary for a healthy child. And then 4, setting yourself up nutritionally for the success of breastfeeding that child. You know, so many women do it the wrong way. They so badly want a baby, but they so badly don't want to do what's necessary to make themselves healthy. And remember, as parents, one of our first and foremost obligations to our children is to lead by example. And so, you know, again, this isn't judging any of you who've had infertility treatments. It's just simply saying, you know, you should think about the nutrition first, right? And if you're not willing to do that, then you run the risks of all sorts of problems, birth defects, and even different types of illnesses like attention deficit, ADHD, Asperger's, developmental disorders, tongue ties, neural tube defects, and all the other, you know, birth disorders that can occur to a child when the mother is not nourished or that the father is not nourished, because it's not always the mother. Many times it's the male. The male has problems with sperm viability or sperm integrity, and so it's not really the egg as much as it is what's trying to fertilize the egg in the form of the sperm. Let's see here. Yeah, so Nan mentions about malnutrition or malabsorption because of having no gallbladder. Yeah, so one of the simplest things that you can do to nutritionally to support yourself if you don't have a gallbladder, Nan, is we actually have something called Lipogest, which is a mixture of different things, but one of the things in this formula is bile. And so when you don't have a gallbladder, that's part of the problem is it's not that you don't have bile, but you don't have a gallbladder is the muscular sac that secretes the bile into the small intestine to help you digest and break your fat down. But once that gallbladder is removed, then the bile is still your liver still produces it, but it can't in a timed fashion get that bile where it needs to go as you eat your meal. So Lipogest is a supplement designed that you take about 10 minutes before you eat, so that bile is ready, so that as you eat meals, especially meals that are higher in fat, that bile is there ready to help emulsify that fat to prevent a long-term malabsorption type of problem. Because there's a lot to fat. Like fat is not just what we think about fat. There's fat. Vitamin A is a fat. Vitamin D and vitamin E and vitamin K are fats. You have omega-3 fats. You have omega-6 and omega-9 fats. They're all very, very critical, very, very important nutrients. And if you're malabsorbing them, then there are a number of different diseases and risks that you have in your future when you have fat malabsorption problems. Let's see, would it be wise to stop a detox protocol and focus on eliminating the environmental factors of mold that can cause more harm to your immune system? You should never try a detox protocol for mold if you aren't sure whether or not you're still in mold. Like that's where a lot of people make a mistake, is they have either a failed remediation or they don't fully investigate why the mold grew, but then they want to jump ahead and do a mold detox. You can't detox if you're retoxing. You know, I mean, that's just common sense, unfortunately. And I see this, a lot of doctors make the recommendation for people, hey, you need to do a detox now, and they haven't figured out where the mold is coming from. Like, don't do that. That's a mistake. People that are in mold, generally when they try to detox, feel worse, not better. And so number one rule of any mold detox is to get out of the mold before you attempt the detox. Otherwise, you're going to spend a bunch of money on supplements and feel horrible during the process, and it's not going to make you any better. If you're looking to detox, what order would you progress? Liver, parasite, cleanse, heavy metals, obviously heal the gut first. There's not an order, Kate. Your body is a detoxing machine. So you're already detoxing as we speak. If you're talking about adding different supplements that might aid or support that process. So a lot of people are like, well, one, there's so much misinformation out there about, I've heard this be said, everybody has parasites and everybody should do parasite cleanse. I don't agree with that. I think that's incorrect. I've also heard it be said that everybody has toxic metals and everybody should do a toxic metal cleanse. I also don't agree with that. I've also heard that everybody should do a liver detox no matter what. I also don't agree with that. So, when you ask me what order of things is important for a detox, I go back to a different question, which is, what are we detoxing? And what are we detoxing from? Like, what is the premise of what we're trying to accomplish with a detox? To just generically say, I'm going to do a detox may or may not be very helpful for you depending on other factors. So again, always ask, what are you detoxing from? If you're just talking about a generic detox that you can do like once a year to help support your body, because we're surrounded and we have, general chemicals and other things in the environment, many of these things we can't control, then support your liver. Support your liver and support your kidney. And you can do an annual, liver kidney support to bolster those organs' functionality to help you navigate the world of, natural exposures to poisons. But you don't necessarily need to do full-blown detox just because. I hope that's helpful. I know I didn't answer your question exactly, but so many people are so focused on detox that they forget to ask a more important question, which is, why? Why do I need to detox? What is it that is going to help me? What is the benefit of doing this? And what is the potential detriment of doing this? And is it the right time to do this? And is it the right thing to even do? Let's see, Elaine asked, what was the product you said earlier for shingles? It's called Virid, V-I-R-I-D. Having a recurrence of a rash on my lower left leg. I'm thinking that stress is the issue because I have been good about being gluten-free and taking supplements that you have advised. Any thoughts and suggestions to help with reducing the rash in addition to my own practice of reducing stress? Hard to say. I'd have to see a picture of it. One. Two, there could be some other things that are triggering that have not been yet identified. Commonly I see people's soaps or detergents or other things, triggering that. And so those would be things maybe to think about or look at. But as a general rule of thumb, part of it is if you're on a protocol and you're supplementing and you're on the right diet and you're moving in the right direction there, sometimes too it can take several months for something like a rash to fully clear and go away. So I hate to say that part of it is be patient. The other part of it is just be diligent and observant and looking to see if there are other things that you are doing beyond that stress that could also be playing a role. Kay's asking about the 5G cell towers. So let's see here. For the last 2 years since they've started putting up all the cell towers, my intracellular testing has shown me having a really hard time keeping my B vitamin, zinc, manganese, copper, and vitamin C levels up. Have you found that to be the case in testing you've been doing on clients? Not really. There may be something else going on there, Kay. I'm not saying it isn't your issue or that it couldn't be. We don't really know the long-term consequences nutritionally of 5G because, unfortunately, we are the experiment. And time will give us more of those answers. That being said, there may be some other things, just depending, I would say, look at other factors too. If your nutrition has been harder to keep up more recently, is there something going on in your gut? Because there's three, the way I like to look at it and simplify it is there's three main reasons why people develop deficiencies. Number one, you're not eating enough of the food, okay? And maybe you are eating enough of the food that contain those nutrients. You know that answer better than I do. Number two, there's a fundamental problem within the GI tract from somewhere from your mouth to your anus where there is a lack of proper digestion or a digestive issue or an absorptive issue where those nutrients are not making it from the food into your bloodstream. And then number three is there's an extenuating circumstance whether it be an underlying illness or an environmental toxicant, again, 5G being the question here, that may be interfering with your nutrition in such a way that your body needs more of certain nutrients to overcome that issue. And so, if you have already explored all of the other potentials, then 5G may be where your mind takes you. I mean, the only way to do an experiment in that regard to see if you're right would be to get out of 5G, which means maybe going on a long camping trip. But I would encourage you also to look at some of the other factors, particularly around the GI tract or other food sensitivities that could also be playing a role in possibly increasing the inflammatory burden in your body that is reducing the gas mileage of how much nutrition you actually need. Let's see, Cal's asking about laser tattoo removal and the scarring. Any advice to help me? Collagen. Lots of collagen. And biotin, lots of biotin would be the two things that I would be doing outside of making sure that you use some type of physical pressure on that scar itself to break up any adhesions in the scar that might form as a result of that scar on the skin. So, like something like a myofascial release to the area where the tattoo was and the scarring is. And then collagen to support healthy skin growth and formation along with biotin. Those, just top three things, easy to do, won't hurt you, could help you. Can gluten-free oatmeal give you anxiety? Yes, because gluten-free oatmeal is not gluten-free, TC. And if that's new to you, if that's new news, go read No Grain, No Pain. Sign up for the Glutenology Masterclass. Did we put a link to that up? To Glutenology, glutenology.net/registration, and sign up for that class and learn about gluten. Because if you think that gluten-free oatmeal is gluten-free, then that tells me that you're not 100% sure about how to navigate the gluten-free diet. So key there is get educated, because once you do that, you may solve your anxiety with a few more dietary tweaks. Best test for leaky gut? There isn't one. There's not one best test. It's because leaky gut is not one problem. There are lots of different reasons and ways leaky gut can form. So there's not like a great test that says you have leaky gut or you don't have leaky gut. There are a lot of insights and clues, and there are a lot of tests that help us understand why a person's gut would leak, but not necessarily that a person's gut is leaking. Because the ones that supposedly measure the leakiness of the gut, you get a lot of false negative on those types of tests, so they're not super accurate. Earbuds or regular corded earphones for working out? Definitely not earbuds. I see people wearing these Bluetooth, headsets, and it just sends a little shiver up my spine, because I know what they're doing is they're cooking the lateral aspect of their brain as that Bluetooth is transmitting information back and forth from whatever device. I've never, ever, ever wear Bluetooth, would never recommend Bluetooth directly attached to your head in any way. And I personally use wired headphones if I'm going to use anything at all. Thoughts on carb calorie backloading? Depends on what you're trying to accomplish. I like macro, macro consideration for a person who's training and trying to achieve an ideal body weight or trying to achieve, greater things physically. If they're working out and they have goals in mind in that regard, carb backloading and also macro counting and macro manipulation can be a very valuable tool. Oh, so follow up on the question on infertility. Does the same apply if a woman wants to freeze her eggs for later use? Now, if you are a healthy person and you want to freeze your eggs for the potential for later use, where we see people do that typically, Mario, would be like in a scenario where somebody had cancer. not a healthy person, but had cancer, and so they were going to choose to opt into some type of chemo or radiative treatment that could cause infertility, and so they might opt at that point to freeze eggs aside so that as they go through that treatment, if they ever do want to have children in the future, they have a potential possibility to do that. And that's a decision every person has to make based on a unique situation. But I would say if you're trying to freeze your eggs just for the sake of freezing them, there shouldn't be a need or a purpose to do that unless you're wanting to be an elderly parent and you're just trying to like freeze those eggs because you're not sure whether or not you'd want to have a child after the age of like 40, which, I wouldn't recommend that anyway, but that's an individual decision. Can you recommend protein powder for post-workout? So I think I answered that already, Chip, but it's ultra pure protein. We can put a link up under here for you and you can read more about it. It's a super high quality protein for workouts and just for protein support. You don't even have to, even if it's not for workouts. So, okay, brown spots on the skin, what causes them? Depends. A lot of times those are called liver spots or aging spots. Generally, it's what causes them is damage over time. So the more damage, and I don't mean sun damage, Now, can sunburning contribute? Yeah, if you're commonly burning yourself, yeah, that certainly can. But the browning of the skin like that is basically it's long-term damage. It also can be an indicator of liver damage. So if you find yourself with lots of brown spots popping up on the skin, you might, check in with your doctor and have them measure, your enzyme levels for your liver. That would be ALT, AST, ALP, and bilirubin. Those would be good 4 things to check right away. And also ferritin. Sometimes elevations in ferritin are indicative of liver inflammation. But also an ultrasound of the liver. An ultrasound is a non-radiative way to look at the liver to see whether or not it is damaged, number 1, or number 2, it is fatty, where there's fatty infiltrate in the liver that could be contributing to that. So that's what I would look for in terms of those types of things on the skin. Any remedies for dry skin on menopause? So yeah, so if it's surgical induced dryness of the skin because of lack of hormone production, Silvio, you might, consider hormone replacement therapy, bioidentical hormone replacement therapy as a potential viable option to help with that. So that would be where you'd want to get with a doctor and have that conversation. But the other thing, just moisturization of dry skin, 2 of my favorite, one is shea butter. Organic shea butter, the other is organic jojoba oil. Either one of those 2 would be a good option to just try to moisturize the skin. Again, not a long-term fix, especially because it sounds like in your case it was a hormone surgically induced issue. Best form of vitamin D3. Be more specific, Bill. What do you mean by that? Best form of vitamin D3. The best form of vitamin D3 supplementally is vitamin D3, cholecalciferol to be specific. And cholecalciferol can be derived from different things. You can derive it from mushroom. You can derive it from lanolin. Many supplement products are made from lanolin. You can derive it from actual liver itself or organ meat. Cholecalciferol, though, is D3, which is what humans would take if they were trying to supplement for vitamin D. How can I get rid of cherry angiomas? Cherry angiomas are oftentimes a sign of estrogen dominance. So I would encourage you to explore a few different things. 1, are you overproducing estrogen? 2, are you underproducing progesterone? Because a lot of people have normal estrogen that have not enough progesterone, and that also can contribute to cherry angiomas. And then one of the other common contributors to cherry angioma is artificial or chemical hormone exposures. And so where we get chemical estrogen hormone exposures would be things like phthalates and plastics and cosmetics, those things mimic estrogen. Excuse me. And so those can create an estrogenic overage that can contribute to cherry angioma formation, and then also mold toxins. There's a type of mold produced by a type of mold called Fusarium that produces an estrogen mimicking mold toxin called zearalenone that can also mimic estrogen, and that can also contribute in that way. Organic soy, is it okay if you have a fibroid? I'm not a big fan of soy in general as a legume, as a quality of nutrition in terms of food. I'm not a fan of soy. Now, if you were going to use soy organically, I would say you want to look at a miso or a tofu, something that is fermented soy, because at least with fermented soy, again, provided it's organic and non-GMO and no pesticides, we have the bacteria that can break the soy, and a lot of the chemical compounds found in soy that are difficult for humans to break down and digest are pre-digested, in a sense, by the bacteria during the fermentation process of creating the tofu. So if you were going to use soy, that's how I would recommend it. But I don't encourage, like, a lot of people want to eat like pure soy edamame, even if it's organic. Not a fan of that. I see a lot of digestive problems associated with that. I see a lot of hyperestrogenic issues also associated with that, especially for men. At least not as a staple food. Now, if it was something you had every once in a while, probably wouldn't be a deal breaker, but as a daily staple, I certainly wouldn't recommend it. Okay, I think we're about 20 minutes over. So let's wrap it up. I want to just say thank you for joining me. And we'll be back here next Thursday at 12:30. We'll also be back here next Tuesday at 6 p.m. Central Standard Time. We've got a special guest coming on with us, so don't forget about that. It's going to be a great show. Also, if you are new and you want to make sure that you don't miss a show moving forward, and you want to have the opportunity to ask more questions in the future, make sure you come visit me at glutenfreesociety.org. Sign up for our newsletter. We'll send you reminders when the show's going live. That way you won't be the victim of the censor. Of the censor folks, the ones that are censoring all this helpful information. And as always, help us with our mission. We're out to save 100 million lives. And in that regard, if you found this information helpful and want to help me in that regard, share it. Share it with somebody who you know needs to hear it. Share it with somebody who you think could benefit from it, somebody you care about, somebody you love, friends, family, etc. Help us bring this mission and this light to the rest of the world. Thanks so much for tuning in. We'll see you next Tuesday evening. Have a great weekend.